Hello, everyone. Welcome to the season 2 of Revising Dentistry. Thank you so much for the amazing response that you've given for season 1. And if you're new to the channel, please go and check out all the episodes of season 1. Today's episode is a little special one because we are welcoming a guest who is on YouTube since a long time now. He is actually the face behind Aspire 32. So, if you are a dentist and if you have searched something on YouTube or on Google, I am sure that you have come across his channel for sure. So, let's welcome Dr. Suresh Shenvi. Dr. Suresh Shenvi has completed his Bachelor's of Dental Surgery from KLE Dental College, Belgaum. He's earned his Master's in Conservative Dentistry and Endodontics from CODS, Davangere. In 2012, over 13 years of academic experience, he currently serves as a faculty member of KLE VK Institute of Sciences, KLE University, Belgaum. He has a lot of achievements under his cap. Check out the episode to know more about him. Let's welcome Dr. Suresh Shenvi. Welcome to the episode, Dr. Suresh. And it's great to have you here. I'm sure that anyone who is a dentist or who is learning to become dentist has come across a YouTube channel called as Aspire 32, which is on YouTube. So if as a dentist, the first thing as when I searched on YouTube, like, dentists or dental related learnings, the first channel that pops up is Aspire 32. So people who don't know, Dr. Suresh is the face behind the Aspire 32 channel.
Thank
So welcome to the podcast, Doctor.
Thank you so much. I should be thankful to you that you have given me this opportunity, and I hope that we will have a very nice discussion. Yeah.
Perfect. I'm looking forward to it. Like I was looking forward to this episode. I searched you through LinkedIn. I was like, I'll connect with you. I'll ask you if you're comfortable. We'll just have a great podcast and have this thing. So, Dr. Suresh, how has your journey been in dentistry? Like, how did it start, and like, how did it happen?
That's actually quite interesting, and I think that's very, very important. I was not a very brilliant student, and I came to dentistry by luck. And when I came to dentistry, that is when I started putting more effort. So this is very, very important because many students who are in dentistry, some of them are there by choice, and some of them are maybe not because of their choice. But what I feel is, regardless why you are in dentistry, if you really give your heart and effort, there is things can change in your life. So that is how I gone through this journey, and it is almost like I joined dentistry in 2003. And it's quite amazing. Of course there are ups and downs with any field. I have my brother who is a liver transplant surgeon. So he had also had a long journey. Same way, I think dentistry, when I joined because my mother thought that this is a field which will be suitable for my son. Of course, because that is the level of intelligence at that time I had, and my brother was super intelligent. More than that, I think it was I was not as hardworking as I was before joining dentistry. And I feel the education has a lot of power. Thanks to my mother, and once I came to dentistry, that one thing led to another. I got into this KLE Dental College in Belgaum, which is now associated with KLE University.
Okay.
And then after that, I got a merit seat in CODS Davangere. There I did my post graduation in Endo. And that is how one thing led to another.
Okay. So, Doctor, I just saw your profile on LinkedIn. You've given so many of entrance examinations, like NBDE. You've cleared ADAT. You've cleared DHA. Like, how did that happen?
That's quite interesting too, because as we all know that at one point of time, once you achieve something, it loses its significance, and you need to set another goal to move forward.
Yes.
During after my post graduation, my brother was in US doing a liver transplant surgeon after his MCH, and that time, as we all know, slightly the growth toward the academic side is slightly less compared to the clinical side. And since my brother went to US, I thought, why not try, at least a US.
The examination, yeah.
But it was a distant dream because I never thought I can go to US. It was a difficult journey.
Okay.
But I was quite hardworking, as I said. That once I think anybody, once they decide something, like you have decided to establish this podcast, and you have
Yes.
tried everything to make it perfect.
Yes.
So I think once you really feel it from within that you want to achieve it, that is how I started, planning for the US, because
Okay.
my brother was there.
Okay.
In meantime, I think it is the people around you with whom you get inspired. And I had few people who had already gone to US,
Okay.
and I thought, okay, let me take their help and at least uh, plan to going to US. So I gave the NBD because my co-PG who finished my PG with me, she was doing a residency in US. So she said, you can definitely try it. That is how I ended up giving the ADAT and
Okay.
NBD exam.
Okay. How was your experience, doctor? Like the whole study material preparation and the examination part. Have you given the bench test,
No,
the clinic?
I was applying for residency, not
Okay.
a DDS.
Okay.
For the reason because the DDS is very, very expensive. And when I asked my brother that I want to go to US and do this dentistry there, so he said it's a big financial decision. You do not take the decision suddenly, but it is always better to come to US, see the place, I think visiting countries just for the sake of exams also is a very good experience.
Yes.
Because the pattern of exam is way different. They are very much clinically oriented, and it's all analyzed properly, instead like in India, because I have been an author of entrance exam books.
Yes.
We ask questions from any corner of the book, because when we write the explanation, we do know that undergraduate student can't answer it.
True.
But the NBD exam was very nicely framed, because everything is linked to your clinical practice.
Okay.
Even the basics question, if they have asked you, it would have some clinical relevance.
Okay.
And it does force every student to think rather than remember.
Okay.
So I found that exam which was very, very useful, and it had helped me to grow as a teacher also.
Wow. You did mention the book that you have written, doctor.
I co-authored The Dentist by Gaurishankar. That's an entrance exam book which I started contributing to it since 2010. Then when I joined as a postgraduate, that is when I joined as a co-author. If you are interested, I can tell you that.
Sure.
So actually what used to happen is there were dental bites and dentist during that time, and along with that dental pulse also there. So I had many senior students, only saying that the Gaurishankar book, the dental bites, had lot of mistake. So which was, I think, more of a printing mistakes. And I know sir very well, very senior orthodontist, and I made a table mentioning what is the answer for that one question in pulse, one question, same question in dentist, and there is another book called as Neeraj Wadwan. And I sent it to Dr. Satish, who is the pulse author, and the Gaurishankar sir. So they really appreciated that. I sent the correction saying that there is like we just complain sometimes. We don't. It is they also need help.
I would say
rather than
constructive criticism rather than complaining. It's like a constructive
very
help.
true.
Yeah.
Yeah. So, but what happens is unless like just saying is not important, you really have to do it, right? So that is how I sent the correction, and I used to mail everyone. That time Orkut was there.
Yes.
So if you remember.
Yes.
So we had that groups, and then knowing people, that journey, which helped me later when I started Aspire 32, started from that step.
Okay.
So in PG, with the help of my friends and with my effort and Sir's blessing, I continued with the co-author of the Dentist by Gaurishankar, and today even it's get published. Once in 3-4 years, we release the updated edition.
Okay, okay. That's great. That's great. So, coming to your YouTube channel, Doctor, Aspire 32, what was the inspiration and using a social media, using a YouTube platform? I think you started in 2017, is yeah, right? So, 2017, like a very early stage where YouTube was just growing in India. What inspired you to start something related to dentistry, and how did that happen? Like,
Uh, that happened when I went to US, and I gave the NBD exam.
okay.
I came across this channel called as Khan Academy, which I am sure you must have seen.
Yes.
By this time, I had this, because we have solved all these questions of foreign universities. You realize that the way you solve the question, the way you think, can be different. So when I went to US, and that you can carry limited amount of luggage with you, so I could not carry a lot of books. And I went to US, and the only source of extra education was YouTube.
Okay.
So I just searched about these topics, and I came across this Khan Academy, and I read the Krebs cycle I saw his video on Krebs cycle. And because the exam, even though I was an author for the entrance exam books, for me again reading basics was also a difficult thing.
Yes.
And I realized that guy with just a black screen and just a white pen, he can make your 1 hour lecture into a just maybe a 10 minutes lecture.
Yeah. Yeah.
So I found it very interesting.
Okay.
So I thought, why not try similar, thing. And during COVID time, I spent a lot of time, and by this time, what I realized is, we all teachers, as a teachers, we tend to think, like we get very seniors in our profession, and we stop thinking as a student, right? So do you agree with that?
I feel that every time when you're so this I have done for one of the I used to prepare people who want to give bench test for one of the firms which is called as Dental Window. So I used to teach them the format of the clinical steps and everything. So I feel that every time you teach something to someone, you are
also
also
get to
learning
learn.
something new. So that's very
That's
beautiful.
right.
Yeah.
Yeah.
So you never stop learning unless and until you just think, okay, you are the professor and you are teaching. Instead of that, every time you teach, you learn something new.
Yeah, but that's actually quite difficult.
Yeah.
That is where teachers struggle. What happens is, it is difficult to accept that you don't know some things in dentistry. And it is difficult to learn with a student, because say, making students aware that you don't know, and in some situations we are at that level, is very difficult.
True.
So and I think that is what I want to improve in myself also. Today also, when I visited Mumbai, I have come here to attend a learning course. But I think this whole process of learning is very, very important for a student, and for the teacher also, because things keep on changing. Same way, this Aspire 32 was it came out through that thought that we want something different. And what is your opinion? Do you think you can teach students through this online medium?
Honestly, sir, teaching as an online medium is something which is very new. like, and especially using a tool which is something which is not personal. But I feel that you can reach a lot of amount of people. Your reach can be increased, and people who had supposedly don't have resources like to travel everywhere and to take that education, as you said in the discussion, that doing dentistry in abroad or learning dentistry in abroad is a very big financial decision. But the same, so now when I was in UCLA, the same mentor of mine, who is Dr. Edward McLaren, he has a few courses which are online. So people who don't want to like spend, like, that much bigger chunk of amount, they can probably sign up for his course online and learn something from him, understand his perspective. So do you think that social media can be used in a very positive way for teaching dentistry? What is your opinion?
No, I think there are two sides of it.
Okay.
I think the major problem why a chunk of teachers do not believe in the e-content or online way of teaching, because there's a lot of resistance. This NAC, everything, he's definitely come out with criteria that the institutes, colleges should have more of e-content for the students. But not everybody finds it, like a compelling reason to go towards it. Multiple reasons. One is many people are not good with the technology. They find it difficult initially, which is definitely true. Second is, what I feel is, unless you have given an exam by watching and learning e-content, you can't believe that it is really possible. Like today I believe that it is possible because I myself have given exam by watching those videos. So you may have teachers who have not gone through this process and they will believe that it is actually not possible. So that is one reason why still not everyone is open for it. But then there are algorithms, in your social media where it is not driven by knowledge or the content of the video itself. It can be more of the engagement. Like what I personally feel is, if you go and Google YouTube, you tend to see shorter videos on the top. That is how, which people find it easier to watch. But especially in endo also, I keep seeing there are the pioneers in dentistry, endodontics. You can find their videos, but they are very lengthy, they are very monotonous, and that is not shown at the higher level of search. So I think not everything it's not under your control. If you just say that you can learn, finding that right content is also very important.
Like, just like a video can be dry but informative, plus there can be a video which is like very perfectly made, but still the content is not that great. So
But how will you guarantee that the something which looks very nice
yeah,
might attract more viewers, and
yeah,
something, I'm not lying. I used to believe that we are doing newer things in endo, okay, but I watched Max Padden's maybe a 8-year 10-year video, and he has spoken about the reciprocating files of that time, 1970, 80, which we keep on talking now. So, but it's a very very simple kind of a talk. Now you need to have that patience to listen to it, and you need to have that self interest.
yeah.
Otherwise, I think it's difficult.
True. From there, I think we can discuss a point which is social media dentistry. Like today, Instagram is so flourishing that if I follow like top dentists out there, they put up the cases and I see this beautiful results and everything. If I think that I am a new practitioner and I see all those positive results, everything, it's too overwhelming for me. But one thing I always want to, like, I always think is they don't show their failures, or they don't show the follow up that happens after probably 10 years or 5 years, and whatever the results are, which is very immediate. So what do you think about that? Like how to filter that thing out? Social media, show dentistry, and social media true dentistry. Like
Uh, Controlling that is very difficult because the it's all runs on algorithm. So if you watch one video, it will keep showing you that kind of videos. But I also agree there are two sides of it. Of course, because it has happened with me in the beginning. Like I used to put uh, uh, 10-15 days effort, and I used to put one video on YouTube, and that won't generate that much of views compared to what a different video, and you start asking yourself where I am going
yeah,
wrong.
yeah,
So, but what I have realized is then I have tried to read, watch, and so I think what is the purpose behind it? Suppose your purpose is just to pass a message or pass a important information. It doesn't matter how many people, yes, whether what is the people criticize it or they don't. Same way, I think in Instagram also, I know it is sometimes depressing to see the level of work. I think one of the reason why I don't know, I might be wrong at this, that why students find the normal way of learning very boring is because something like a very complicated case is shown in 1 minute, and it made appear like it is very simple
yes,
because you don't know
yes.
you don't know how much effort is put.
The amount of months or the amount of revisits of the patient, that is not shown. It's just before and after, but the amount of efforts are not seen in that.
Yeah,
Yeah.
but then what happens is the newcomer or the someone who has just joined, he doesn't understand how much effort is required.
Yes.
And every case is different in dentistry, right? So although the techniques are similar, but it's not that easy to do, like it's not that easy to get that kind of result in every case. But one greatest advantage here is that I have few Instagram, the dentists who are very approachable because of one this reason. You can today message them and ask them why are your results so good compared. No, I'm not able to get it. So I have done that. Like few years before, when we used to struggle with composite polishing and all, and these people get amazing polishing. I messaged them and they told us about all those newer polishing agents, which you may never think that you should use it. So that is one positive advantage that you can now contact them.
True.
Of course,
Do
there
you
is a
think like a
negative
lot
side
of
of it.
people are still like have that fear or that block that, oh, if I message them, will they reply or will they not? But I think even one of my friend who has like put up cases, and he has messaged the professor from abroad as well. They have also replied and everything. So the message is basically, if you like the work, if you have certain questions, just approach them. It's much easier through Instagram, and that is one of the benefits that you can take of that platform. Like,
Definitely, I think, and if the speaker, the dentist is really, and he wants to make a difference in people,
yes, yes, yes.
his aim would be definitely to reply. But it's a very very big platform. Imagine 100,000 people messaging, and
Yeah.
how will you, like, suppose you have a YouTube channel and you post one video, people will ask you, 10 people will ask you make another video on this topic. It may not be possible always.
True.
But yeah, that is definite an advantage, and I think we should definitely use
Take
it.
make
Yes.
use of it. Perfect. And what do you think, like, currently the education system in dentistry, currently whatever the methods are going on, the methods that we had at in 2000, the beginning of 2000s, and the current methods, like, how can they benefit from these YouTube, Instagram, in the normal, like, in the 5-year course of dentistry? Should they take use of it? Like, should
No,
that
this
methods
this
change?
this see, I think we are at a phase in a transition. Foreign universities have already moved ahead because they are in technology. They are definitely ahead. But in our country, we are at a transition phase, and that is why all these committees and these regulatory bodies are making sure that everyone compulsorily generates this e-content. But what is happening is you have an old system which is running parallel to the new system, and there is not enough justice done to both the sides, right? Because a teacher might be asked to teach in a conventional way, and teacher is also asked to teach in the modern way. It's difficult to because the work, how will he concentrate on one simple thing? And I think maybe another 5-10 years down the lane, things will change. But it is already happening. But in spite of all these things, ultimately, how will you learn depends on the self-interest rather than what content you have given them. If you don't have the self-interest of learning, no matter what way of learning you have, I don't think you can ever learn.
Okay. So, this e-learning platforms, I have seen a lot of dentists coming up with their set of teaching and videos and everything. Uh, how can a dentist filter out probably or choose like which is something that I want to do before, like, how can I filter out that content? Like, this topic is something that I really want to go ahead with. So, this person is exact for that part. Do you think is there any process to it, or you can just start with something which you feel connected most to?
No, the realization that what you don't know is very important. Like many times, like I used to learn photography, I have attended workshops, and in maybe initial 1 year, once like many times, what happens when you attend a workshop, you are assuming that you have learnt everything. It is not true, because dentistry is not so small that you learn things with one workshop. Workshops are helpful. I have learned a lot from workshops because you find great mentors. But the important thing is, every mentor has a different approach for each cases. So what we all can do is, maybe you can, depending on your financial situation, because workshops can be expensive. Uh, it is not necessary that something which is very expensive always teaches you more. This is also my realization. I may be wrong in this, but you want to learn any topic, you can go and search YouTube. You can find hundreds of videos which will give you so much information. But what happens is, since it is not everybody would like to learn it that way, because there is no interaction happening. But there are courses, keeping the finances apart. Mentors can teach you very well. And I think today, it doesn't matter. It's not that you have to teach everything to a student or someone. You just have to generate an interest. And if you have an interest, you can find different sources of, way of learning.
True.
I'm sure you must have done the same
Yeah.
when you had thought of
Yeah.
conducting a podcast.
Yeah, you start learning through YouTube only because that's the free platform. You look for videos, photographies, the cameras which are there. That's not how I started. Like, for podcasting also, I was like, how it happens. And like, I did some, in fact, online workshops only. So I think in dentistry, that is also coming in a lot. But even physical interaction is important, I would say. Like, that one-to-one interaction, or that the doubts that you have that needs someone to interact
You
to.
do need a mentor.
Yeah.
And I think that is where these things are very useful, combining different formats.
Yes.
Like you attend a workshop and generating, or workshop not, or maybe a class, in a theory class or a college class. Once it generates that interest, and maybe you attended a workshop and it generates interest, many people do not go in depth in that topic. Like, let us assume there is an file in endodontics. Right? You have one file, you have attended one workshop. There are different concepts in that. So I don't think one should stop at one concept. You should go and find more information. Maybe by attending different workshops or online courses or YouTube.
Yeah. or Aspire 32. It has a lot of videos on that.
No, actually, I don't have a lot of videos. My total number is 200.
Yeah.
I want to do more videos. Hopefully, I will start.
But have you gotten anyone coming to you that you've been an inspiration for me to start my channel on YouTube or something like that?
There are, but I think it is their own hard work and the credit goes to them. Because it's a lot of effort. And if there is an interest which is generated, and I'm thankful to it. And I hope that I can put more effort in make it grow.
One of the comment which has stayed with you, like any of the comment on your videos which was very special for you, like okay, like this came and it's like a push, because I can relate to it. I did. So this episode that we are shooting is season 2 first episode that I'm doing with you. I finished my 10 episodes already, so I really wait for the comments more than anything. Like, so any of the comment of your YouTube video that has stayed with you?
But there are many, but one I think which I got recently, that where the student said that I have paused the video and I'm writing it, that this is one of the best video which I have ever seen on this topic. That was something which was very special. The good thing is you never think, it's a surprising thing that when you make a video, you don't think it can make such a huge difference in somebody's life.
Yes.
But I think it's a good platform to meet the. Of course, it becomes demanding also.
Yeah, it push, but comments and everything pushes you also, but it demands a lot of work from your end as well, because you need to keep doing it. If you like take a pause or stop it, again, as you said, it's all on algorithms. So you need to.
No, I have taken a pause. Like initially, I used to make videos. Actually, the journey was very nice. I actually made the video for my own students.
Okay.
And nobody saw it, so I stopped doing videos. And then after a few months I checked the statistics, and then I realized that doing it for you should not think that people who are with you are making video for them, because as you said, the platform is very huge, and today any corner of world can find a teacher which is suitable for him.
Agreed.
So that is how I started, and of course it is demanding. So during COVID I gave a lot of time, and then there was Howard Farhan. There is a guy called as Howard Farhan. He called me for a podcast in his channel.
Okay.
That time I realized that I have made this educational kind of videos, but I did know that finding information for abroad is very difficult. So then I look back and I saw that with whom I have been helping, or they have helped me. They are my colleagues. I requested them that okay, you come to on this platform, and we can do things like a podcast kind of a thing. So that was the second phase of my YouTube channel.
Okay.
And then third one was when I started working with magnification microscope. I thought it is important that we can show this kind of work to people. But we are not doing something different. I think everybody is doing same thing, but a different period of time in a different way. And they get connected with a different type of audiences.
Okay.
So like you are practicing endo, like we all are practicing endo long back. Now also we are doing, right? In future also endodontics will continue. But the mass is different, and everybody thinks it is different, when the way of your teaching may be different.
Yes. So, do you think that, like, in today's practice, if supposingly a dentist is opening up a practice or any clinical practice that is going on, what are the 3 basic advances that they should, like, put in from day one? Like 3 habits and 3 advances in dentistry that they should start doing and continue in their practice.
What's your review on this? What's your, because you have gone to US,
Yeah.
you did your implantology certification.
Yeah.
What do you think? Because you have been practicing for so many years. What is your
This is
opinion?
becoming reverse podcast.
No, no, I'm just very keen because I don't know. Like I would let you know my answer.
Yeah.
What?
So I feel that, like, I my message to the dentist out would be that don't get overwhelmed with all the things that are coming together in dentistry. Start with the basic knowledge, get your concepts cleared, like, and the advancements that you can use is probably start with the basic scanner which is going on, and if you want to start digital only altogether, but learn the techniques which is conventional as well. And the second advancement probably they can go ahead is you inculcating the photography data from day one. Like, if they can start managing the data of the patients, because that is going to be helpful in future to, like, convince other patients as well, plus to keep a medical record as well, is something which is very important. And the third thing I would rather say that, like, start taking the consent forms as well, because where the like practice is going on currently, medical legal things are going to be more and more particular in, so get the consent and get the return record on paper that, like, you're doing a patient, the history, and discuss it out with the patient first. Obviously take the history, everything properly, mention it down, and keep recording it. Like, my suggestion would be that.
That's true. I think pretty much I also have the similar view. But there are two aspects here. What it depends whether what you want and what are you doing for your patient.
Yes.
Uh, there are definite advances, but there are some things which are very basic, as you said. I think one thing which we all don't use majority is like as simple as a mouth mirror, which is a front surface one. Like I have worked with a normal mirror for many years, but the mirrors like jerk mirrors, and also once you get used to it, it's very difficult to go back to the other mirror. So it's as simple as that, but very, it makes your work interesting. You can see things better. I have been, very like I want everyone to do at least some form of magnification, which costs very less. Incorporating a loop in today's practice is very, very less. Because what I feel is eventually, although dentistry is your passion, but it is ultimately a work, and you might find it some aspect which you keep doing. It might become boring in some aspect. So when you look at things in a different way, it generates an interest for you. So one way of doing is that using, I understand microscopic practice is difficult for people, like the actual way of doing microscopic practice. But you can at least incorporate a loop, which we have started with second BDS in our institute.
Okay.
So I think that is where it should start.
Okay.
Apart from that, as you said, DSLR is definitely must, or any way of photography, a proper way of photography, not because what I have realized is that we all have that photography, but then we click a photo and we compare it with the way the pictures are in social media. They are not of that quality.
Yes.
And I got this fixed light from Kellin Pop, this softbox. With you may have a very high photographic skill, but without those accessories, you can't get that wow kind of pictures.
True.
So having that full-fledged setup, because that makes your work interesting. And I think more than endo, the restorative work gives you more joy, because you see results, it like you can clearly see it. In endo is, yes, it's more of a pain relieving procedure, and but there is a lot of stress also is there in endo, right? Because there's so much of effort which is required. But restorative is good for the tooth, and you can see the colors, with the photography. These are must. I think music is something which we all should incorporate. You can have your patients will also enjoy it, and you will also enjoy it, right? And today's world, I think digital dentistry scanner is something which is very, I don't know, majority colleges are not teaching that there to the students.
They should
Yeah,
start
you
teaching
can
it.
at least, we have to eventually move to the digital way.
Yes, yes,
So
yes,
that
yes.
is one thing which I think we can incorporate.
Yeah. And I would suggest that, like, if you're starting a dental practice, visit your lab. I don't see a lot of dentists doing that. Like, visit the lab that you're giving your work to. So you'll understand and create that kind of communication system with them, so that whatever you are sending, there'll be certain specific things, and the person also should understand that what is work that is expected from them. Lab communication.
But it is not the people's fault here. I have been asking this question to myself. The problem is we do not teach students the importance of lab in their school days. So when I had finished my post graduation, we had no idea what is a DMLS, coping, because ours was a very good institute, but a small lab. Now, of course, with time things have changed. You have more access to good labs. Things as simple as like a die cutting.
Yes.
People are not aware that die cutting is important for work.
Yes.
Right. So it is not people's fault. I think it goes back to our education and schooling. Everything is linked to that. You know, if you can show a student the importance of some things, like if you have shown him importance of loop in the dentistry, it is easier for him to incorporate that in practice. Otherwise, trying something new is very difficult and scary for any practitioner. And you have to do financial calculations, whether it will fetch me. But when you are learning, you are not thinking about the finances, the return of it. You are only thinking what will help me learn from it. But when you are trying to incorporate it in after you set of practice, you always ask this question that let the patient, start paying me
And then
more,
I'll do that.
then I will do it.
Agreed.
So I think it goes back to our education.
Okay. Okay. Do you think that, like, even the education system should teach us, like, importance of the other small things that we have in clinic? Like, just a small example, we are learning everything on aeroter nowadays, but there is something new that has come up, which is like a brushless micromotor, a brushless motor, that all the people abroad are using. Like, they have shifted the dentistry from aeroter to that. Here, I don't see that many dentists working with that part. So, do you think that the coping up thing with the abroad is very difficult for Indian dentistry, or we are trying our best to reach there? Like, these small things, they are also very important. When you learn anything, when you're watching the YouTube or watching Instagram, you see those beautiful preparations done with the, as you said, the light and everything is there for sure, but the margin that they create, the softness that they have in their preparation, the whole thing behind it is like there are a lot of things which are not seen on that. So what do you think, like, what do you think about that?
Uh, I think people don't want to take all those considerations again. That question of how much is it in return it is fetching us. But there are some things which you have to do in spite of whether it is fetching you any return or no, like financial return. Because you should be happy with your work, right? Ultimately, that also matters. Like otherwise, you won't get sleep in the night. You will not find dentistry interesting. As far as the electric motor, the high torque one, I think those there are practitioners, but since the good one costs more than 1.5 lakh rupees, so people may avoid doing it. But there are very very small things, like you can have the ultrasonic tips which people use for refining the margin. That is also available. But out of, I think, going back to that question, what is the most important thing in our practice is the time. If you don't have a time oriented practice and you are calling 10 patient sitting outside, you will not try to fine tune things. Like with the loop also, like your same restoration looks different under loop. But then that phase of adjusting also is there. You can't do it if you have patients waiting outside. And I think, I don't know whether it is right to say, our education system also,
It all boils down to
it is
that.
more about doing more number of patients, jaldi jaldi khatam karo, patients
Quota hai
waiting
ye.
hai, quota hai. Like nobody is telling you. Like I have visited some practices where there is a limited number of practice. Okay. And can you do it? Of course you can do it. I am not saying that you do one patient in a day.
No.
But at least, and many times what happens is there are 10 people waiting outside and you are not doing anything, they are just waiting
True.
anyway. Right? Instead of that, you can call 2 patients and concentrate and call 2 later.
Yes.
But because the patients are waiting outside, the whole aim is to do the work faster. But it goes again back to the schooling where we are taught to treat in masses rather than doing it comfortably and enjoying your work, knowing the role of the assistant. Right? There can be multiple reasons because we are a developing country, right? And many people can't afford dentistry even today. So that is why the institutes are framed in that way. But let us assume if you had an opportunity where in a week, in a day, you had something like you teach them that level of comfort dentistry, slow dentistry. Maybe things might change.
Do you think that as a teacher you can change the mindset who are more like they have come out, seen the clinical dentistry at different stages? It is easier to mold that mindset, or at the stage where they are students, they are learning, they are like, हाँ dentistry लिया है तो अभी ये तो सब करना ही है. So do you think it's more moldable at that stage, or once they come out they get the reality check that what dentistry is, like clinical dentistry, how to modify that? Do you think what stage do they get the realization better?
I have been asking this question to myself, and when I see my son, that many times, like people in US interviews also, one common question is, where do you see yourself after 5 years, 10 years? Trust me, at the age of 20, 25, 30, I had no idea where. You can say, I want to do this, but you actually don't know. Like you are saying. But you don't know whether it is actually possible or not. You are just hoping that it will happen. But now, you meeting people, seeing things, and there is, for every student, every person, the mindset of changing develops at a different stage. Like I used to see that my brother, he was very sure what he want to do at a age of 15, 16. Clarity. It's so clear. I was asking this question. That is what I'm trying to find. How are some people can vision it and some people can't, and that is what gets the difference. Like you can see that so many people are doing things differently. Agreed. Right? But we, some of us might find it difficult to even think of it, to even start. Like showing my face on YouTube first time, it took me so many months to think, I can do it. But once you are on the YouTube, it doesn't make any difference. But it's just the thought. Right? So passing that barrier, it's difficult. There are some students who need push during your schooling days only. And even if you do during that time, it will definitely change. There are some people who don't understand why we are trying to do it. But you still have to force it on them. Because as a role of a teacher is whether the students feel it is important or no, it is your duty to do it. Right? Because things make sense after 10 years, not on that day. So that is what I think. We can just show them what is the best.
Agreed. Customize your journey is basically like customize. If I'm a dentist, I may do something like within immediately getting out of the dental school, but there might be someone who might do it after 10 years. So that period is like to each his own. To each his
Definitely,
own.
for some people are happy with whatever they are doing.
Yeah.
They don't feel like I want to do it different.
Yeah.
Some people are highly career oriented, and I think it is all about finding different mentors. Your journey
Yes.
is you found one mentor, you learned from learn from him,
Yes.
then you take the next journey.
Yes.
So it is all about finding different mentors and learning from them, and then self learn.
Never stop learning, basically.
Absolutely.
Never
Absolutely.
stop learning.
Yeah, but that's the most difficult thing. Learning is the most difficult thing.
Agreed. But I'm sure that like nowadays using the whole internet based this thing, it's easier. Like, even if you are in your own practice sitting thinking that I don't have time to travel, do that, just go online, find some course, do it. Like, create that curiosity, and probably that can divert in good learning.
But something which is easily accessible also sometimes loses its importance.
Wow.
You don't think that?
I agree.
Because see, suppose something is available and
Yeah.
you will not find it that important.
Yeah. Arey, this is to there. Why you want to do
yeah,
it?
and
It's
then
easily
you go
available.
back, attend some workshop, and then you come back and see, अरे ये तो
Yeah.
वही है, इसमें
जो-
सब कुछ information है.
Agreed.
Right? So it is not about I think it is about when you feel like कि वो मुझे वो interest generate हुआ है और मुझे वो सीखना है.
Okay.
वो होना ज़रूरी है rather than what source is available.
True. True.
It can sometimes happen today or it can happen after 5 years.
Yeah.
You never know.
True. Okay. So again, see, I have this question in return here only. Where do you see your dentistry in 5 to 10 years?
I don't know. I feel we talk too much about dentistry and time goes just, it's like you are just 25 and you become 40.
Yes.
And it's okay to talk about dentistry. Absolutely not wrong. But I think time goes very fast. And what I've realized after 10-15 years now, that people we all stress so much about all this journey settlement and take so much stress for it, but without stress also these things will eventually happen the same.
True.
Right? You went to US.
True.
I am sure that journey would be like filled with so much of excitement, difficulties,
Yeah.
confusion.
Agreed.
Without that confusion things will fall in place.
Agreed.
Right? So I think it is important that we enjoy this journey. I also tell the same thing to my students.
Okay.
Like we all tell students that this whole curriculum is about exams. Right? You think you have to learn this because you want to appear for exam, and that is why this is important.
Okay.
And but learning, there are so many things which if the exam is taken out of equation,
Yes.
all those things are as important as the things which are there. Like in endo you see, you have a mandibular molar ka root canal treatment in the final exam, you have an anterior composite restoration, and you have some other aspect like inlay in some colleges. But what I've realized is that what about other things? Right? So there are some colleges which will only focus on root canal treatment. Because it is there in your exams. Inlay you have to do because it is there in
In
your
the
exams.
exams, yeah.
But don't you think that class 1 composite, class 2
equally
composite,
important.
right? Doing that class 2 with new generation matricing system, with Niranjan sir's, rubber dam. And I have heard his podcast also here. Like, don't you think that is something which is important, and do you have to do it just because you have to give exam and that is why you have to do it?
Agreed.
Can't you take it out of equation and start learning?
It's just like you have to see the dentistry as a whole. We are taught into branches, but when you come out, you start practicing. you'll come to know that ultimately it is all together in one. Yes, yes, and it is all related, because if you can't give a crown, there is no point in doing a root canal. So if you can give a crown, which is the best way to give crown, but if you're doing a good root canal, that will last a little longer also. But if you give everything best, like, given a best root canal, give the best crown, but there is an issue with the occlusion, the whole treatment can fail. So at the end, you sit back and see that it's not just branches or each thing, it is all together, which is connected, and it's like together in one. So as we mentioned Niranjan sir's podcast, the first thing that we discussed on the endo, when we started the endo podcast, is like he's like, my whole efforts right now goes into that, how I cannot push the tooth towards endodontics. It's better to do prevented, like prevention is also that important part of dentistry. So it's the whole thing that you look into the picture of.
Yeah, but unfortunately that doesn't happen with the current way of learning.
Okay.
When I was writing ComEdK papers, ComEdK was one type of entrance exam. That time state entrance used to be different. There used to be a
There were a lot
ComEd.
of
I think I don't know Maharashtra में उसका क्या था.
associate
हाँ, correct.
associate था.
Yeah. So there one section used to be case based question.
अच्छा.
Okay. And like there will be one paragraph and you have to learn the paragraph and then write the answer. That time it did not make any sense that why these kind of questions are asked. But then when you go to this foreign exam, most of the questions are case based. They will give you that perio chart, photos, you have to integrate. But unfortunately, that type of case based learning is very less, and it is more about seminars where the students are very smart. They know I have the already PPT, and they will present it in a very nice way, but they don't understand it because there is no integration happening, right? You are presenting one topic. Let us assume you are presenting a case of endo. You are just talking about the file. Like सेमिनार में अगर आप रोटरी इसका ही फाइल के बारे में ही बोल रहे हैं, एक सेमिनार आपने प्रेजेंट किया, आपका वर्किंग लेंथ का सेमिनार होगा 10-15 डेज के बाद, फिर ऑब्जर्वेशन का आएगा 10-15 डेज के बाद. तो ये वो कैसा, हाउ विल ही इंटीग्रेट इट? बट ही इज डूइंग दैट केस ऑलरेडी, right? He is doing that root canal already, which in the clinical side he is doing it. Can't you ask him those questions कि ये आपने अभी क्यों ऐसे क्यों किया, ये अभी क्यों किया, or it do it in a case based learning where the students is forced to think different scenarios and integrate. Of course they will not be able to do it initially because they can't think the way we ask these type of questions because we have already integrated it, right? Some of the aspect. But the whole idea of doing this case based type of study is to make sure to think them in that way. Right? All these foreign exams basically see whether you critically think rather than just mugging and answering.
They have this part in foreign examination, which is the treatment planning.
Yeah.
Like they will give you an OPG of the patient, they'll give you a basic history, and they'll tell that plan the case, like how you will treat that patient. So in this thing, it's very important to have the details and minute knowledge as well, plus to see it as a bigger thing also, so as a whole. So that exercise helps you that you have to see patient from a human angle but from a treatment perspective altogether.
So basically the student is thinking.
Yes.
Right.
Yes.
That's the best way of learning.
Yes.
But I don't
the
know.
system that we have.
No, it is not a wrong system. I don't say anything wrong. But what happens is you have been shown one type of system and you are forced to follow that one type of system when there are other type of systems which are available.
Yes.
It is, see, and I think the curriculum has opportunity to do everything.
True.
It has. You can do case-based learning. You can do, but the people who are making rules for the learning, it is for him what matters. That is what will be implemented. Sometimes maybe there is a better way, like e-content for some students it might be very good, but the person who is reinforcing might not find it so important. Right? So I don't know.
Do you think that we are expecting too many things from dental school? Like what they are teaching. So I had this podcast with Dr. Das, so my first ever podcast. He said the dental school is just going to teach you ABCD of dentistry. You make sentences when you come out of it. Do you think there should be such forums even out, like apart from the dental schools, that should, like, maybe encourage more comprehensive thinking towards it, like using the cases and everything? Like, what do you think about that? It's just struck me right now. That's why I'm
No,
discussing.
see, you can't learn everything in dental school. That's fine. Again, there
Agreed.
is a time is
Agreed.
very less.
Agreed.
Okay, because we have so much of other things, like the logbook, all those things. So much time is goes into that. This is interesting because one time somebody mentioned from some other branch that endo 3 years is not required, and that branch requires, it is not possible to learn things in 5 years also, which I found which absolutely wrong, because even in endocon there is so much things which you cannot learn in even 5 years.
Agreed.
Because which is true for every branches. There
Yeah,
is
yeah.
things which are changing.
Yeah.
But what I think is that will be always there. How, regardless whatever you are teaching to the students, then they will have to keep on learning ahead also. But that doesn't mean that we don't reform things in that at a school level, right? Many colleges have reformed. It's not that the people have not. There are reforms which are happening. But there might be some places which may not. It may have taken a lot of time, or it
Time.
might take a lot of time.
Yeah. For you, like, when there is this reformation thing, like, what is the definition? What is happening currently, and what is more required in the next stages of dentistry?
I think we have to teach our students, as I said from beginning, what is quality. Quality, at least show them what is different, and learn in depth rather than having superficial knowledge, because it's very easy to get superficial knowledge. Like you can have videos everywhere, but that is not where you need to stop. You will have to go back to books, right? Maybe watch those boring podcast or the videos, not just an attractive one. And have a habit of self learning. As per reformation, I don't know what has to change. I think many things are taught in colleges, but somehow they are not followed. Right? You can take a practice management chapter from Soben Peter, where it is mentioned that in your waiting room, only one patient should be there. That is what is mentioned in the Soben Peter, if I am not wrong. I had read long back. But not everyone follows it. Some people might say, जिनके पास patient कम है वो करेंगे. I said it's a choice. Right? It is basically a choice what you have to do. Some things are already taught. We don't follow it. It is not that I am following everything. Somewhere there are things which I am not following. But I'm one day, if I get enough motivation, like shifting to one mattressing system to another mattressing system, because we are not taught that mattressing system. That jump can always be taken by attending one workshop or having the just mindset of trying the material. Other
If people want
reforms,
to approach you as a mentor, should they use the platform like Instagram, something like? If
no,
they
there
wanna
are there are definitely better mentors. There are amazing mentors in the world. Okay, I think the
three people who you get inspired from.
three people, I think at different stages, people have inspired me for different aspect.
Okay.
I attended Dr. Siju sir's microscope workshop. Before that also, I have learnt it from YouTube. It is more about finding the mentor, right? And I found him very, very positive. And of course, he also mentions the difficulties, everything. It is not that he only shows you
Good picture.
Yes, he is not like that. He inspired me to think in a bigger way. Like you want to set one special kind of a practice. Whether you are able to do it or not do it, it's a different thing. Niranjar sir, he inspired me with his rubber dam skills, all these knots and all. I have rubber dam course. I have applied for it, but I think he motivated me with all those things at this moment. Um, photography, Dr. Vishal Kabra was there. I mean, Dr. Mayur is also there, who is a very good friend of mine. But that time I had access to Dr. Vishal.
He's in UK, right? Right now?
He is right now in UK.
Yeah.
So he motivated me. Even today he guides me whenever I need. But there are many. I think top three is very difficult to say. We can't say who is best among the mentors because everybody has taught you. How can you say who is the best one?
And even Kumaraswamy sir mentioned, it's not necessary you have one mentor. You can have many mentors, you approach them and then create your own style and what inspires you.
Yeah, you yourself can be a mentor for so many people.
Agreed.
Right? Because everybody has some or the other qualities which people will definitely seek.
True.
Tomorrow, maybe by now, people are already seeking to you how to conduct these amazing
Podcasts.
recordings. Right? Same way, people might think how people have asked me how to do a YouTube channel, which I have helped them.
Super.
But it is not that we have started it today. Like people have done it before also.
Yeah. True.
It is just that we are approachable. So
True.
People find us approachable.
Super. So let's come to an end to this podcast, Doctor. Any message that you want to give it to our listeners or viewers out there? Any specific message?
Message is whatever you are doing, do with a lot of faith and passion. Of course, have a in-depth learning from that topic. Do not seek to learn it superficially. It doesn't help in long run because ultimately dentistry is not as easy as it looks, that you can learn things in one day or seek more information. Look for better things in early age of your dentistry. Okay, even though they are difficult, but that will help you, that will save you a lot of time. Because the time is the most important aspect and it will never come back.
Start valuing the time more. Then obviously you should value the money aspect as well and everything. But time is something that if you start valuing that, you will be at another
it is
place.
more precious than anything else.
Perfect. Thank you so much, Doctor, for coming in for this podcast. And it was great to have you here. And I think we'll keep recording more and more. I'm inspired to do a endo podcast also with you now. Like apart from this thing, I'm sure like
we
plan.
will definitely. We can. There's so much to talk on. So
Exactly.
Many things.
Dentistry is huge.
Definitely. And I want to thank to you, ma'am, that you
Thank you
called
so
me
much,
and
sir.
gave me this opportunity and have helped me with this collaboration so
Yes,
that
sir.
we reach the people and whatever I have shared today,
Yes.
hopefully it will inspire some people with some information.
Definitely, Doctor. Thank you so much.
Thank
Thank
you.
you.